The member for Gippsland.
Thank you, Deputy Speaker. And I rise to express my support for the government's announcement of the Productivity Commission inquiry into disability services, and particularly the consideration of the merits of a publicly funded social insurance system to help cover the cost of the care and support of people with a disability. The level of support for carers and people with a disability was one of the key issues that I raised in my inaugural speech, Deputy Speaker, and like many others, I continued to highlight my concerns in the committee in recent months. In addition to improving the level of financial support, we do need better access to health services, particularly in regional areas and particularly for children with disabilities. For example, we know that early intervention will allow children with autism and other special needs to achieve better outcomes, but the lack of availability of allied health services is frustrating the efforts of parents to support their children at this most vulnerable time in their lives. As the children with disabilities get older, many adult carers are faced with the uncertainty and a terrible angst about the future of their loved ones. We need to develop a better national system which overcomes the current confusion across state borders and provides certainty for families that their children with disabilities will be cared for throughout their lives. At the moment, Deputy Speaker, we leave the older carers in an insidious position where they are concerned for their own health, but at the same time desperately worried about who will look after their children when they're gone. Deputy Speaker, the Parliamentary Secretary for Disability Services, Mr Shorten, is someone I've had conversations with and I've written to on behalf of my community, and I'm confident he is working to overcome these issues. He made a speech earlier this year in Western Australia where he highlighted the fact that 1 in 12 children have a disability, and that's 317,900 children with an impairment that could lead to a developmental delay. And another number that the Parliamentary Secretary referred to is that 500,000 Australians are primary carers of a person with a disability. And Deputy Speaker, these people are saving our nation a king's ransom, but they have paid an absolute pauper's support service in terms of the financial support we're able to offer them. The current system for looking after people with disabilities is disjointed and it's not working. We must consider all the options for improving long-term care and support. There's no question that it will cost more money, and how we fund the system in the future is a key issue for governments at state and federal level. The concept of a national disability insurance scheme has been raised in the past, and I do support it in principle. It would allow the government to fund a better safety net for people whose lives are affected by disabilities, either at birth or acquired through injury or illness at a later stage. And I refer again to some of the comments from the Parliamentary Secretary in the media today in the Age newspaper, where he's quoted as saying, "At the moment, if you have a terrible car accident or a workplace injury, there is reasonable coverage under state compensation schemes. But if you are born with a disability or fall off a roof, you're in a very residual system." And I quote again, "We need a sustainable system which isn't crisis-driven and which can be funded according to the needs of the disabled, not according to the cause of their disability." Deputy Speaker, in the time that's left me, I would also like to refer to the fact that we simply don't have a definition of what constitutes a disability, a consistent definition across state borders, which is adding further to the confusion and adding further to the angst of our carers in the community.